first thing I want to do today is really talk about why do they get sick, and then talk about development of the gastrointestinal immunity. And then I'll jump into and spend most of my time talking about how nutrition can influence the immunity of calves. And the first thing I'll just spend a few seconds talking about how we can reduce the interaction of potential pathogens with the calf's gastrointestinal immune system. So obviously if you can reduce that interaction between the two, you can improve health, okay? I'm not going to get robbed unless somebody comes to me and actually tries to rob me, okay? So that's one way. And then I'm also going to kind of expound a little bit on how level of milk replacer nutrition can influence immunity, both during the pre-weaning period, but then I also want to talk about some data where we've looked at how early life nutrition can influence health after weaning. Okay, so that's kind of the outline of what we'll do. Okay, so everybody has seen these statistics, okay? A lot of calves get sick and die, okay? Anywhere from 8 to 11% of pre-weaned heifers die. And if you ask producers why those calves are dying, they'll say about 60% of them will say it's associated with gastrointestinal disease. I think that's underestimated because I think a lot of calves become septicemic, which is a gastrointestinal disease problem, but they may not have scours. So point is, I think a lot of calves die in the first few weeks of life, and most of it is associated with gastrointestinal disease. And we also still have a problem post-weaning. About 2% of post-wean heifers die. That's going to be more associated with respiratory disease at that age. And here's just some comparison, some CDC data of human neonates. So again, we have a lot lower rate. So again, this has to do with management. Okay, we can decrease these, but again, I think we need to understand the problem first. That's what we're going to talk about. Okay, so disease resistance again is a balance between microorganisms that the animal's exposed to and then the immune system or the immune responses of that animal. Anytime you shift this balance in favor of the microorganisms, the risk of disease goes up. Okay, so if you raise animals in dirty environments, risk of disease goes up because you've shifted that balance in favor of microorganisms. You can also suppress the immune system. You've heard a little bit about that today, or suppress components of the immune system. And again, what you're doing is shifting that balance in favor of the microorganisms by suppressing this side of the equation. Okay, so why is the risk of mortality greatly decreased after the first few weeks of life? Okay, so that's the question we want to ask: is what has changed in this calf during this period that has greatly reduced the risk of disease? Okay, some of you have heard me say this before. I just had my first daughter 3 months ago, and it's funny, when she is born, I'm stressed out because I'm thinking, if she can just survive 2 to 3 weeks, she'll be fine. Okay, so you can see my wife's like, why don't you hold the baby? I'm like, why don't you just hold her and not breathe on her and kiss her so much? But she's doing really well. But so what has changed in the calf during this period? Okay, so some components of the gastrointestinal immune system. A lot of the components of the gastrointestinal immune system actually develop in utero, and you start seeing some of that development as early on as the first trimester. But the point is there's going to be some postnatal maturation of the gastrointestinal immune system. That's what we're going to talk about today. So the calf is in a bit of what I call a catch-22 situation, because we know early on that animal has to passively derive some macromolecules, including antibodies from colostrum. But what this also does is it increases the risk of translocation of other potentially pathogenic microorganisms anyway. Okay, so the animal needs that, but also it increases the risk that some bad things are also going to get absorbed into the animal's body and potentially into blood. Okay, the ideal situation would be absorb a lot of antibodies, don't absorb any microorganisms, and then have that gastrointestinal tract rapidly mature. Okay, that would be the ideal situation. There's a lot of components, okay? Hey, the guy in the back that's sleeping. This is important for the clicker question. There's a lot of components to the gastrointestinal immune system, okay? They don't call it, just think of, my question is actually very easy if you think about it. There's only one question that kind of addresses multiple components, or one answer. Okay, it's an immune system, okay? Just like a house alarm system, there's lots of components to an immune system, okay? So there is a physical barrier. That's probably one of the most important things. And it's probably one of the biggest things that's compromised in a newborn calf is the physical barriers, okay? But we also have a chemical barrier, so there's various chemicals that are secreted from the gastrointestinal tract that we'll talk about that potentially limit the growth of bacteria. There's also an immunological barrier, and then there's a microbial barrier, okay? So again, there's a lot of components to this gastrointestinal immune system. It bothers me, okay? And again, I understand, because I research a lot of this stuff. When people ask me, I want to measure the immune system, what's one thing I can measure? Okay, that's kind of a stupid question because you can't measure a system by measuring one thing. Okay, on the opposite side of things, there's probably 150 things you could measure, and obviously you're not going to measure all those. So you got to pick a few of things that you think are important and go with that. Okay, but again, I want you to, one take home I want you to understand there's a lot of components to the immune system. We're going to walk through these right now. So here's kind of a fuzzy picture, okay, of the gastrointestinal epithelium, or the mucosal surface. Okay, so let's just look at some of the different components. So again, the first barrier is the physical barrier. Okay, so just having all these, this is an enterocyte here, so one of the absorptive cells of the small intestines, for example. There's lots of enterocytes that line this, okay? And that's preventing potential bacteria up here or virus up here from interacting or getting into this animal's body, okay? So just the physical barrier. You also have other cells like goblet cells that are also part of the mucosal surface here. And then there's these tight junctions in between these cells that basically don't let anything pass in between those cells. Okay, so we have these things that hold these cells together tightly, so where stuff can't go in between them. Okay, that's called paracellular translocation. So again, there's different types of cells here. There's even Paneth cells down here, and we'll talk about these. They're found at the bottom of the crypts here. But you have lots of these epithelial cells, and again, it's creating this physical barrier that won't allow bacteria or other potentially pathogenic microorganisms to get past there. One of the cells I already kind of touched on was this goblet cell, and these goblet cells are really important. They produce lots of mucus, okay? And so you can kind of see that this there's this mucus layer that actually covers this, and they show a little bit of the mucus like right here. So that mucus also is part of the physical barriers, okay? So again, you put mucus on this surface, it doesn't allow potentially pathogenic microorganisms as easy access to that. So again, those are two components of the physical barriers of the immune system. What's interesting is you have these Paneth cells down here. They produce lots of antimicrobial factors, a lot of chemical factors like defensins, lysozyme, other things that actually will kill bacteria directly. And so these Paneth cells produce these things and actually gets caught in that mucus layer, so it's forming kind of this chemical barrier over the gastrointestinal tract as well. You also have these lymphoid aggregates in the lower part of the gastrointestinal system, and they're constantly kind of sensing antigens out here in the gastrointestinal lumen. And what they're doing is they'll eventually start producing antibodies, and they produce IgA primarily, but they'll start producing IgA, and what happens is these IgA also kind of localize themselves in that mucus area too. So you also have some immune and chemical things that are preventing bacterial growth in that mucus layer. And what's the third one? Oh, the microbial barrier. So everybody knows that we have trillions of bacteria that live, and people have probably heard the statistics. You have more microorganisms in your gastrointestinal tract than you have cells in your body. The point is you have a lot of microorganisms in the gastrointestinal tract, and a lot of them are pretty healthy for you. And they also are going to compete for substrates and space with potentially more pathogenic microorganisms. So that microbial barrier can also be thought of as part of the gastrointestinal immune system. All right, I stayed on that slide too long. Okay, so why is a calf in the first couple weeks of life more susceptible to disease? Okay, so I'm going to talk about the holes in those immunological barriers that we just talked about. So here's a simple histological slide of the distal ileum of a calf at birth. And what you can see is they're highly vacuolated. And so what these vacuolated enterocytes do is they pinocytose. So they actually will just engulf anything that's out here along this, closer to this quote-unquote brush border here, but they'll start pinocytosing this thing, okay? And what happens is that's how a lot of those immunoglobulins are absorbed, is through pinocytosis. But what they can also do is start pinocytosing a bunch of E. coli or salmonella or anything else and taking those things into the enterocyte. What happens is you start seeing changes in these vacuolated enterocytes pretty quickly. Okay? As soon as you feed colostrum, these things start changing quite rapidly. It occurs in a proximal to distal fashion, so meaning that you start seeing these vacuolated enterocytes disappear in the duodenum first, and then it moves down to the ileum last. Okay, and then you also see it occurring in the crypt first, and then lastly at the villus tip. So a lot of this, when you look at this from a quantitative standpoint in the gastrointestinal or the small intestines, let's just say 90, I'm making up numbers, but I'm the one standing up here for now, and 90% of these vacuolated enterocytes are replaced within a day or two, okay? But as you move down and start looking at the ileum down at the lower part of the gastrointestinal tract and the villus tip, you'll still see these things for a week or two, okay? So that's why this is still going to be these animals are still going to be at an increased risk for disease because there's persistent vacuolated enterocytes, and primarily in the lower GI, which is actually where you end up seeing a lot of the microorganisms live. Also at birth, there's reduced tight junctions in between these enterocytes, so there's a higher risk for some paracellular absorption of microorganisms. And then you also see goblet cells increase their secretion. So here's a picture of a goblet cell down here, so you can see lots of these little goblet cells. So again, those goblet cells are really important in producing that mucus layer that covers. It's another physical barrier, but that physical barrier is also going to contain lots of chemicals and other immunologically derived substances that are going to prevent microbial growth. And so what happens is we know that goblet cells respond to microbial exposure. So we know when a calf's born, it has not been exposed to that many microorganisms, and the GI tract is relatively sterile, and it starts to be colonized by lots of microorganisms. And so there hasn't been a lot of data on this because that mucus layer is kind of hard to study. But conceptually, I would say that mucus layer is developing postnatal as well. Looking at the chemical immunological components, I talked about those Paneth cells that are at the bottom of the crypt. They produce lots of antimicrobial factors. And what you see is Paneth cell numbers and secretions increase postnatal. Okay, this data is from rodents. This is not from calves. This data doesn't exist in calves that I know of. But what you end up seeing is Paneth cell numbers and secretions increase postnatal. Secretory IgA concentrations are low. Okay? Point is, the adaptive immune system is going to be naive, okay, in a newborn animal. Okay? And the one benefit different things. And so for your adaptive immune system to actually work, you have to have been previously exposed to it. So what happens is secretory IgA levels increase as the calf develops its own immunity. There is recirculation of colostral antibodies. So if you do get colostrum fed to your calf and it gets absorbed into the systemic circulation, you do get some recirculation, and I think it's like 3 or 4% of the absorbed antibodies recirculate back to the gastrointestinal tract each day. However, the half-life of many of those antibodies are only 1 to 2 weeks. So those antibodies, I mean, if the half-life's only 1 to 2 weeks, that's why you end up seeing a lot of gastrointestinal disease again after 1 or 2 weeks. Okay, like for example, rotavirus. If you vaccinate your dry cows against rotavirus, you get a lot of rotavirus antibodies in your colostrum. You feed that to your calf. They get absorbed into the calf. Those antibodies are recirculating back to the gastrointestinal tract, helping prevent that calf from getting a rotavirus infection. However, the half-life of those antibodies is only, let's say, 10 days. That means in 10 days, half those antibodies are gone. So again, that animal is now at an increased risk for disease. Colostrum, to me, is really important. When I look at, well, I'll get to that in a second. I'll talk about what colostrum is. You can't have a calf talk without at least a couple slides on colostrum. I've got 2. Okay, so looking at the microbial barrier, there's 1 trillion potential, or 1 trillion plus or minus, I couldn't quantify it, I just said a lot of microorganisms that live in the gastrointestinal tract. Most of them are not a threat to the calf. Okay, a lot of these are, the ones that are not a major threat to the calf are these strict anaerobes. And if you look at an adult animal across most species, greater than 99% of the microbes that live in the gastrointestinal tract are going to be these strict anaerobes like Bifidobacterium or Lactobacilli. In neonates, there's a progression from facultative anaerobes from the environment. Okay, so early on, you'll see a lot of Enterobacter, Streptococcus, and Staphylococcus colonizing the gastrointestinal tract soon after birth. And what you'll see is that as that animal ages, they'll become more strict anaerobes. Okay, it'll look a lot more like the adult. The problem is a lot of these facultative anaerobes include things like Salmonella, E. coli. Okay, so again, until you get that progression to more strict anaerobes and get a better competition against some of those facultative anaerobes, they're going to be at a higher risk for disease from those from the environment. So back to our original question of why do so many calves get sick and die during the first week? Okay, the risk is great, and the point is that there are a lot of holes in the gastrointestinal immune system for the first few weeks. Okay, so I hope that you saw that the 4 layers of the gastrointestinal immune system I showed was there appears to be holes in all levels of those. And so, you know, a suppression in any one of those by itself can increase the risk. And when you start combining multiple factors, it's not surprising that the risk is great among those animals. So now what I want to do is talk about what role can nutrition play, okay? So what is the most important thing we can do on a farm to improve the health of dairy calves? Okay, I told you I had to give a talk on colostrum, okay? So we know if you don't give colostrum, they're at a really high risk for mortality, okay? So what is the goal of colostrum management? Why? Somebody just say, what is the goal? Why would you feed colostrum? What's the main thing we're looking for? Get IgG, okay? Everybody agree with that? We want to get passive transfer of immunoglobulins, okay? Most people say passive transfer of antibodies, okay? So there is more to colostrum than just antibodies, okay? There's lots of different compounds, and this is not anything new, okay? Many compounds in colostrum and transition milk are involved in postnatal development of the gastrointestinal immune system, okay? I think we would, if we took our shift of colostrum management from just measuring total plasma protein, okay, as a measure or a proxy of total IgGs, and we actually fed colostrum or designed colostrum management around improving gastrointestinal maturation, we can improve health and reduce morbidity and mortality of these calves. Okay, so again, our colostrum management strategies, you know, getting 4 quarts of colostrum within the first 6 hours, and then switching them directly to milk or milk replacer. That's all designed about getting effective immunoglobulin transfer. It's not looking at how is colostrum and even transition milk involved in increasing how fast that gastrointestinal tract matures, the immune system matures. Okay, because we know there's lots of compounds in that colostrum and transition milk that will hasten the maturation of the gastrointestinal immune system. That's it on colostrum. You want it clean too. Okay, that's all my talk on colostrum. So there's some different strategies you can do to prevent the interactions of pathogens with calves. Okay, so there's 4 different things that I've kind of quickly highlighted here, and we're going to spend a couple slides talking about it. Okay, prebiotics are not easily digestible by the calf, but they improve bacterial growth. Probiotics are typically strict anaerobic bacteria, so those are some of those quote-unquote good bacteria that are going to compete with more potentially pathogenic bacteria. Hyperimmunized egg proteins are egg proteins that have been, or these laying hens have been vaccinated against a lot of potentially pathogenic microorganisms like Salmonella, E. coli, K99, coronavirus, rotavirus. And so they produce these IgYs in the egg, and so you can feed those and they have a local effect in the gastrointestinal tract. Or you can also feed plasma proteins. Okay, so we did a really simple study a while back, and we looked at the effects of a combination. So we threw a blend of prebiotics, MOS and FOS, and probiotics. There were 5 different strains of probiotics in this study, as well as we also fed hyperimmunized egg protein on growth and incidence of scours in calves during the first 3 weeks of life. Okay, we fed total of 90 calves, 45 calves got the product, 45 served as a control. All calves were fed a half a gallon of a 20/20 milk replacer twice daily. And then fecal scores were determined prior to each feeding by 2 independent trained observers. And if they did not agree, they went back and decided what that fecal score would be. Okay, here's the fecal scoring we've done. I'll talk in a little bit why fecal scoring is not maybe a great measure of health. But so 1, the feces is firm and well-formed. 2, it's soft, more like pudding. You don't look at pudding the same after you've scored a lot of feces. 3, runny pancake batter. 4, liquid, pulpy orange juice. And then we classified scours for this study as a calf with consecutive fecal scores of greater than or equal to 3. Mortality was low. Only 1 control calf died. Supplemented calves refused. These calves were less than 12 hours old when we got them. And so one of the measures we looked at was voluntary milk refusals. So supplemented calves refused less milk during the first 4 days of life. So they kind of went on milk a little easier. Supplemented calves also had reduced incidence of scour over the first 21 days. So 24.4 in the treated group versus 50% in the control group. But there was no difference in calf starter intake or average daily gain in the study. Not all studies have reported benefits in GI health or resistance to gastrointestinal disease, but no studies have reported adverse effects. Mechanistically speaking, looking at prebiotics, probiotics, hyperimmunized egg protein, plasma proteins, all those things should reduce the risk of disease because they're reducing the potential influence of a enteric pathogen with the host. And one other thing is use research-backed prophylactic treatments. Okay, so there's a lot of products out there. I would just recommend, starting with something that actually has some research done with it. Okay, so now I want to talk the rest of my time about quantity of milk solids. Okay, so I've heard this quite a bit. I'm not surprised so many calves die because we starve them. Okay, I hear that a lot. Is this true? Okay, it sounds nice, and So let's look at whether or not this is true. I'm not going to go into too much detail about this, but how much should I feed my calves? So there's restricted quantities, which is 1 to 1.5 pounds of solids a day, or more similar to nature. On the other side of the spectrum is 2.5 to 3 pounds of milk solids a day. Okay, so I'll consider this kind of a lower plane of nutrition, and somewhere on this side of the spectrum more of what I consider a high plane of nutrition. So why do we limit feed? And we've heard a little bit about that today, is that you can wean them earlier because they start eating more calf starter. Okay. The funny thing is a lot of people will restrict feed, but do they actually wean them earlier? They don't. Okay. You end up going to their dairy and they're weaning at 70 days, 80 days, 90 days. And so all I tell them is if you're going to feed that total amount of milk, why don't you just shorten the window and actually then wean them? And then a lot of people look at it's more expensive to raise a calf because 1 pound of milk solids is more expensive than 1 pound of calf starter. So it is more expensive to raise them to weaning when you feed more milk to them. However, in a lot of the scenarios, when you look at cost to raise them to a first calf heifer, it really is not that much different. Okay, but at the end of the day, when they're looking at how much they're spending on milk, and they're not used to that, it is a little of a challenge to get them to adapt to that. Okay, but then again, the point is we need to say, is there a good reason to be feeding higher planes of nutrition? Say, unfortunately, we don't have a good idea of the long-term impacts of restricting milk. Again, there's been some meta-analysis conducted in showing that calves that are fed higher planes of nutrition produce more milk during that lactation. Okay, again, I'd like to see some large prospective studies done in a commercial dairy or on multiple commercial dairies to validate this. I think that needs to be done. And again, these different programs, different names for them. I'll use plane of nutrition. So my approach has been looking at, does plane of nutrition influence health of these animals? Okay, so there's been a couple studies that have looked at risk to enteric disease challenge. So one of them done by Dr. Quigley, who's in the room. You can ask him more about this study if you want. But he used a high-risk group of calves and then raised them on coronavirus-contaminated bedding. 120 Holstein sale barn calves, poor colostrum management. They either fed them a restricted quantity of milk, a pound of milk solids per day, or they fed them a variable program, started them out for the first week at that pound, and then increased them to 1.5 pounds during the second week. And then during the third week, they were fed about 2 pounds, and then they were dropped back down. So those were the two treatments, just a restricted or a variable higher plane of nutrition. And then again, they were all raised on wood shaving bedded or contaminated bedding with coronavirus. Results were the days with scours increased by 53% when fed the variable program, and days on antibiotics were 3.1 versus 1.9 for the variable and conventional respectively. So in this study, the calves fed the variable higher plane of nutrition had an increased susceptibility to that coronavirus challenge. Another study where they did a challenge was a Cornell study where they challenged the animals with crypto at 3 days of life. They either fed half the calves a higher plane and the other group were fed a lower plane. And what they ended up seeing was the was the Holstein calves fed the greater plain of nutrition maintained better hydration, as evident by hematocrit, and fecal scores improved faster. Okay, if you look at, and you just read the abstract, which a lot of people do, and you would say, okay, fecal scores improved faster. But if you actually go in and look at the data, they're improving at a really slow, I mean, they are statistically different, but the fecal score improvement was pretty small. And then there was no difference in oocyte shedding. So in this study, the calves actually maintained, to me, the main conclusion was they maintained better hydration. The fecal scores did improve, but it was at a quicker rate, but it was the effect size was really small. Okay, so what I want to do is spend some time talking about some studies we've done at Texas Tech. So the first study we did there in 2009, we had 42 bull calves, 20 Holstein, 20 Jerseys, and then half the Holsteins were going to be fed a high plain, half were going to be fed a low plain, and then half the Jerseys were going to be fed a high plain, half were going to be fed a low plain. So it was a 2x2 factorial. The low plain, we fed a pound of 2020 milk replacer, irrespective of whether or not they were Holstein or Jersey. The high plain Holstein, for the first week, we started them off at 810 grams, and then we increased them for the remaining pre-weaning period for almost 1,200 grams, so up to that higher level. High plain Jerseys during the first week were fed 570 grams, and then they were increased to 680. When you look at it, the amount of grams that they were getting relative to their metabolic body weight, it wasn't different between the Holstein and Jersey in that treatment. We did a subcutaneous LPS challenge on these calves at day 7. I was partially interested in thinking, I had a hypothesis thinking that Jersey calves were a lot more susceptible to septicemia because they had a lot more active inflammatory response. So that's one of the reasons why we factorialized this study. And then I was curious whether or not the high plain of nutrition would influence the sensitivity of the inflammatory response at that age too. And then on day 4, 42, and then 77, we started weaning these calves on day 42 and completely weaned them probably around day 49. So we took blood measurements early on when the risk of morbidity is really high, right before weaning and then about a month after weaning. And we looked at various neutrophil and other immune responses. One of the outcomes were the high plane of nutrition calves, irrespective of breed, had increased plasma haptoglobin 24 hours after the LPS challenge. So they had a more intense acute phase response after the subcutaneous haptoglobin or LPS challenge. There was no difference in neutrophil oxidative burst or whole blood killing of a live E. coli at day 4 or 42. However, the calves that were previously fed, the Jersey calves that were previously fed the higher plane of nutrition had improved neutrophil oxidative burst and whole blood killing on day 77. So just looking at this quantitatively, I'll just show this for example. This is the percent of E. coli that we incubated with whole blood that was killed after 10 minutes of incubation. And so again, you can see no treatment differences this should be a 4, at 4 or 42 days. But those calves, the Jersey calves fed the low plane of nutrition had suppressed E. coli killing at 77 days after weaning. So one of our next questions then was, does this influence the susceptibility to disease? Okay, among those Jersey calves that were previously fed the restricted plane of nutrition, and they had that suppressed neutrophil and whole blood killing capacity in the post-weaning period, does that actually influence susceptibility to disease? So in a follow-up study, we enrolled 46 Jersey calves, fed half of them a low plane, the other half a high plane, similar to what we did in the first study. And we weaned them about 45 days of age in this study. And then on day 84, we challenged them with 10 to the 7th colony-forming units of a Salmonella typhimurium. And then actually in this challenge, we only took 20 bull calves for the Salmonella challenge, and then ended up being 11 low and 9 high. So here's some data looking at the fluorescence intensity of L-selectin on neutrophils in circulation. And this is days post-enrollment. So again, we wean these calves starting at 42 days of age. And so what you end up seeing is that the low plane of nutrition calves have more neutrophil L-selectin, or more, L-selectin on their neutrophils in circulation prior to weaning, and then it disappears. There's no difference after weaning in this study. So this was all during the pre-weaning and immediate post-weaning period. Now the next data I want to show you is looking at after we did the Salmonella challenge. And this is looking at plasma haptoglobin on the y-axis, and this is time following the challenge. And what you end up seeing is that the low plane of nutrition calves have an increase, and actually there ends up being a treatment effect over the entire period for low-planning nutrition calves to be producing more of this plasma haptoglobin. The challenge dose of the salmonella we give did not cause mortality in the animals, and actually only the dose I call is a disease dose 50, so only 50% of the calves should show some clinical signs of disease. And so again, what we end up seeing is that the low-planning nutrition calves have more systemic inflammation after the challenge than the high plains, which is consistent with our previous study. And then when you look at calf starter intake, so there was no difference prior to the challenge, and but pretty much right after the challenge, we start seeing some separation in calf starter intake, where the low-planning nutrition calves are eating less calf starter than the calves previously fed the high-planning nutrition. We also looked at, every day we did some whole blood inflammatory cultures, as well as looked at neutrophil oxidative burst. And what we saw was in the high-planning nutrition calves, those responses were upregulated quickly, and then became downregulated more quickly in the calves fed the high-planning nutrition, which may explain why those calves had lower measures of systemic inflammation. Another interesting thing that came out of the study were the low-planning nutrition calves had elevated L-selectin prior to weaning. And so going back to some of what you're looking at is, are these calves fed the low-planning nutrition? Are they doing a lot more non-nutritive suckling and increasing exposure to microorganisms, therefore stimulating some of these innate leukocyte responses? So we did another study to kind of test that hypothesis, or just kind of confirm that data. We did this with Holstein heifer calves, fed a low or high-planning nutrition. We gradually weaned them at 45 days of age and completely weaned them after day 52 after they were consuming 800 grams of calf starter dry matter. And so again, primarily looking at, are we stimulating neutrophil and other innate leukocytes by feeding them a lower planning nutrition? And that's exactly what we saw. So as early as 3 days after we started the study, and again, these calves were 1 day old at enrollment. So early on, we see calves with the low planning nutrition have more neutrophil L-selectin. So their neutrophils are primed, you can say. And then what happens is we wean them, and then 2 days after weaning, there's no difference. And so in this study, we also saw a difference in neutrophil oxidative burst, kind of in the same magnitude. And again, these are pretty large differences we're seeing there between these calves. So again, our kind of working hypothesis is that calves fed restricted quantities of milk replacer, due to the increased non-nutritive suckling and non-nutritive oral behaviors, are stimulating the innate immune system of those animals. And so we're also interested in how that influences the microbiome of the calves. A more recent study that we just finished up this year is we did a digestibility study. I've been interested in doing this for a while, understanding how well do those calves digest those nutrients during the first week of life. So we enrolled 12 Jersey bull calves in the study. Half of them were fed a low plane, half of them were fed a high plane during the first week of life. We basically measured everything in versus out of the animal. And we broke it up into, so these calves were 6 hours old when we got them. We adapted them to our barn and to their diets for 1 day, and then we started our measurements. There was no difference in fecal dry matter percentage, so 31.9 versus 30.9 in the high plane, despite fecal scores being greater among high plane and nutrition calves. So our fecal scores were higher, they looked more loose. However, when we actually did the dry matter percentage of the fecal material, there was no difference in fecal dry matter. There was no differences in the amount of energy digested, 92.8 in the low plane versus 92.7 in the high plane. Protein digestion and nitrogen digestion and nitrogen retention were greater among the high plane and nutrition calves. So digestible nitrogen was higher in the high plane, so 88.5% of the nitrogen was digested in the high plane versus 83.7% of the nitrogen in the low plane. And then that extra digestible nitrogen was actually ended up being retained into lean tissue at a pretty high rate. So 86.6% of the intake nitrogen was retained in the body in the high plane versus 81.8% in the low plane. So again, digestibility of nutrients in a healthy group of calves, we had no scouring in the calves. We had some fecal score 3s. We had no fecal score 4s. In a fairly healthy group of calves, calves can digest the nutrients very well and possibly better than when fed lower planes of nutrition. So in another study, we did an enteric challenge of calves at 10 days of life. So we did 20 Jersey bull calves fed either a low or high plane. We challenged these calves orally at 10 days of age with 10 to the 8th colony-forming units of Citrobacter, which is an opportunistic infection. And so, again, going to cause a real low chance of disease. And had these calves been another 2 weeks old, we probably would have seen no clinical signs of disease. But we had done a little bit with this to show that it does cause a mild disease in an early calf. So we looked at performance, health, some blood metabolites until 24 days of age, where we harvested the animals and looked at some tissues. Average daily gain among these calves, we'll just kind of quickly pick out some things here. So prior to the challenge, high plane of nutrition calves gained about 300 grams a day, where the low plane of nutrition calves lost a little bit of weight. Pretty common. We see even after the first 4 days after the challenge, the high plane calves have a drop in their body weight from where they were at, from 0 to 10. And the low plane of nutrition calves are increasing a little bit. And that's primarily going to be due to that they start eating some calf starter. But again, just typically you see that the high plane of nutrition calves continue to at least have a tendency to gain more body weight even after the challenge. Looking at some of the other data, high plane of nutrition calves had higher rectal temperatures after the challenge, so 38.6 versus 38.4. The increase in rectal temperatures, I don't show it. It took about 3 days till they peaked, and they peaked at about 1 degree Celsius higher than prior to the challenge. Again, fecal dry matter, I didn't highlight this here, but I want to point this out. Fecal scores were higher in the high plane of nutrition calves again, just like we saw in the digestibility study. However, just like we saw in the digestibility study, fecal dry matter percentages were not different than those. And if you go through and look at where we actually ended up scoring things different is at a fecal score 3. A fecal score 3 on a calf fed a high plane of nutrition is different than a fecal score 3 on a calf fed a low plane of nutrition is where we ended up seeing that. We also approached the tendency for peak haptoglobin concentrations after the challenge to be higher among the high plane of nutrition. No differences, well, there were differences in plasma glucose and urea nitrogen, but I'm not going to talk about those. Looking at the villi and total mucosal height of the distal ileum, we ended up seeing that there was a numeric difference for high plane nutrition calves that have a greater villi height. And then when you looked at the total mucosal area, we saw that there was a tendency for the high plane nutrition calves to have a higher total mucosal area, which may be explaining some of what we saw in terms of digestibility in the digestibility study. But this also could be increasing the risk for enteric disease too, because you increase the surface area that these potentially pathogenic microorganisms can be looking at or interacting with. Another interesting thing we saw was we measured water intake in this study. And so prior to the challenge, so again, we challenged these calves at day 10. Prior to the challenge, calves fed the high plane of nutrition consumed more water. And after the challenge, they had a significantly greater increase in water. So remember the Cornell study where they showed improved hydration? They didn't measure water intake in that study. I'm curious to see if calves fed higher planes of nutrition consistently just consume more water, and that could be explaining the large difference in hydration they saw in their calves in that study. So water intake is important, I think, in future studies looking at plane of nutrition to quantify. Conclusions looking at risk for enteric disease. Fecal scores are not an appropriate measure of enteric health, especially when comparing planes of nutrition. Healthy calves are able to digest and absorb nutrients well during the first week of life. And if feeding restricted quantities of milk increases non-nutritive oral behaviors, the risk, okay, we're dealing with risk, the risk for enteric disease could increase because of greater microbial exposure, just because they're licking the environment more, okay? Anybody that's fed calves, if you look at them, they're just always licking stuff. You're like, if you just wouldn't lick that, you'd probably have a better chance of surviving, okay? So, again, this may be something that we're influencing risk by just increasing their non-nutritive oral behaviors. However, some data indicate that the risk for enteric disease is greater when fed a higher plane of nutrition. So we really need to start probing into those measures of the gastrointestinal immune system I talked about earlier and seeing how plane of nutrition influences those. Because in our last study, we saw that total mucosal area tended to be higher. Again, we didn't have a lot we had 10 animals per treatment in that study, and we were able to pick up a tendency for total mucosal height. Just by having a greater surface area, you could increase the risk for enteric disease too. And there could be a pathogen-calf interaction. Okay, I want to wrap up talking about a study we just finished this fall where we did a respiratory challenge. We had 30 Holstein bull calves. They were either fed a low or high plan of nutrition. We weaned them at 54 days of age. And then at 81 days of age, we challenged them with 10 to the 8th plaque-forming units per nostril with bovine herpes virus 1. These calves were vaccinated and boosted during the pre-weaning period with a 5-way. So they were vaccinated against bovine herpes virus 1. If we hadn't, this would have killed them. But this dose will induce pretty good nasal lesions and induce some inflammatory response to that. 3 days after we gave the viral challenge, we went in and we factorialized this, and we either gave 10 to the 6th, 10 to the 7th, or 10 to the 8th colony-forming units of mannheimia at 84 days of age. And we gave that intratracheal. And then we followed those calves for 10 days after the challenge. 4 out of the 15 low plan of nutrition calves died, and there was a gross necropsy showed that it was consistent with respiratory disease. Looking at the different doses, it was 1, 2, and 1, challenged with the 10 to the 6th, 10 to the 7th, and 10 to the 8th, respectively. And then 0 out of the 15 high plan of calves previously fed the high plan of nutrition died in this study. So again, just looking at mortality rate, there's something going on here. And so you can't really see the nasal lesions in here from the bovine herpes virus. Our next study, we'll get better pictures of those. And then this is going intratracheal with the mannheimia. So here's just a couple pictures of a couple of the calves that died. So again, you can see some hemorrhage here. You can see some consolidation and hemorrhaging of the lungs that's consistent with pretty diffuse pneumonia in those animals. Okay, looking at some of we took blood samples like every 30 minutes for the first day after the challenge and did a lot of these different things. But one of the things we've looked at so far is looking at the hematology. And so this is looking at the percent of neutrophils in circulation. So this down here is our 6 treatments, high plane challenge with 10 to the 8th, high plane challenge with 10 to the 7th, high plane challenge with 10 to the 6th. You really see no difference in the increase in their neutrophil counts. However, what you end up seeing is the low plane of nutrition calves challenge with 10 to the 8th had really high increase in the percent neutrophils in circulation. And it dropped in the 10 to the 7th, and 10 to the 6th, or among the low plane, was not different than the 10 to the 7th. But you can see these two treatments were both higher than the high planes given the same dose of the mannheimia. Serum haptoglobin was also higher among the low plane of nutrition calves, so consistent with that there's more inflammation and disease in these animals. And this was consistent across both the IBR challenge, or the bovine herpes virus challenge, as well as the bacteria challenge. So conclusions, looking at risk for disease later in life, data are indicating that post-wean health is improved among calves that were previously fed a higher plane of nutrition. So that's coming from our enteric challenge with salmonella, and then this more recent data with our respiratory model that we're using. It'd be interesting to look at whether or not this continues, just like everybody else. Does this continue to persist later in life? Does feeding animals, how we feed animals during the first 2 months of life, does it influence their susceptibility to diseases when she becomes a cow?